What if you have a temporo-mandibular disorder TMD patient who is symptomatic? TMD patients are the most challenging and complex cases to treat. If you choose to treat these type of patients, the number one thing to remember is to design an appliance that supports the jaw joint. The key to treatment of these TMJ disorder patients is to understand the condyle and the articular disc position and the extent of degeneration in the jaw joint. CBCT and MRI are the foundations for helping us diagnose correctly and establish the vertical we want to create in the appliance design to help these patients get out of the symptoms quickly. With these type of patients, we need to know if we are dealing with muscles, joint or both. We also need to be clear with the patient regarding the purpose of the appliance, and I want to make sure the patient understands what the appliance does and doesn't do. And then we want to know the outcome of this therapy. Is it the reduction of the wear on the teeth or a decrease in the symptoms, or is the outcome to simply establish the optimal joint position so that we can move to restore the patient later on? If we have a patient where we will be changing the jaw position and establish where she needs to be in order to be pain-free, this appliance will not only be used for symptom resolution but also as a guide for the next phase of treatment so we can restore the bite in this position permanently. In these patients, design an anatomic orthotic which will contour and mimic the teeth to allow movements in all directions and provide vertical, horizontal and lateral support in chewing, speech and at rest. The basics of design include raising to the opposing, canine guidance, anterior mandible reposition and detailed posterior anatomy to allow lateral jaw movements. After printing this appliance, additional fine-tuning is often needed in the patient's mouth to account for the finite movements in lateral and excursive and follow-up to ensure symptom resolution. Stay tuned for part 6. Don't forget to save it. Don't forget to share it. Take care.